Once we formed an embryo, human development occurs in 3 trimesters. So the first trimester is the very first 3 months that a woman is pregnant, um, from the time of conception until about uh, 15 weeks. So the first trimester is the time when most of the organs change. All of the organs develop, and by the end of the first trimester, once all of the organs have developed, we go from calling it an embryo to a fetus. So in the first picture on the left, you can see the head here and the limb nubs. They don't really look like limbs yet. Um, and then this is going to be the backbone, and look, you actually have a tail. The size of this entire structure is 7 millimeters, which is less than 1 centimeter. And then this is at 8 weeks, where all of the major structures have formed. At this point, all of the organs are present. There's a brain, there's eyes, there's fingers, there's a liver, a stomach, spinal cord. They're all there, they're very underdeveloped. And so this is when you go from being an embryo to a fetus. And on the bottom here, you can see a size comparison between the 7 millimeters of the week 5 and 4 centimeters, which is over 4 times larger at week 8. The second trimester is when the baby continues to grow. There's not as much change here, but at this point, the placenta is strongly established and attached, and so the second trimester, the risk of miscarriage is dropped dramatically. Most miscarriages happen in the first trimester as that placenta is growing. And so the placenta takes over creating progesterone, which is the hormone that helps to maintain the pregnancy. So you can see here at week 14, which is the beginning of the second trimester, and then only 6 weeks later at week 20, which is right in the middle of the second trimester. And there's a vast difference. We go from kind of still looking a little bit like an alien to very much looking like a small human. The third trimester is the last 3 months of human pregnancy, and this is a time of very little change but rapid growth. This is when the fetus changes the most as far as size. And so most women put on a lot of weight at the very end of the pregnancy because the baby goes from weighing 1 pound to 8 to 10 pounds in the last couple of weeks. And so it expands the abdomen, and it squeezes pretty much every other organ in the abdomen out of its way. And so the bladder is very compressed. Many women have issues with constipation and digestive motility, as the stomach and the digestive system are very compressed. This also causes heartburn because the stomach doesn't have very much room, and so stomach acid can wash back up into the esophagus, which can cause heartburn. Once the baby has reached about 38 weeks, it's considered full term and is usually safe to be born full term at that point. Childbirth happens in a process called labor. Labor is all of the events that are used to expel the fetus and all of its associated tissue. So labor occurs in 3 stages. The first stage is the dilation of the cervix. This typically takes the longest. This would be when you would start to feel labor pains and contractions that would start far apart and get closer and closer together and become more and more painful and intense. This is the part where you may see the water break, and you would probably be going to the hospital or going to whatever care facility to go ahead and get ready for birth. The next phase is called expulsion, and this is the actual pushing phase. And this usually happens fairly quickly in comparison to phase 1. And so this is the expulsion of the infant and the delivery of the fetus. There's a third phase, sometimes called the afterbirth. which is the birth of the placenta and the rest of the surrounding tissue or fluids. So this removes the umbilical cord and the placenta from the uterus of the mother. Uh, Sometimes child conception is facilitated with reproductive technologies. So we call these art assistive reproductive technologies, and they're used to help couples that are trying to conceive and are having issues or are infertile. Our current medical definition of infertility is the inability to conceive a child after 12 months of trying. This doesn't mean that somebody can't have a baby with a little help. One type of assisted reproductive technology is called in vitro fertilization. You can see an image down here of what happens. First, the eggs are collected from the female. This usually involves several rounds of hormones, where the woman goes through hormone injections to make sure that the eggs are ready, and then undergoes a procedure to collect the eggs. Sometimes this step actually fails, and there are no eggs to be collected, and then the woman will go through rounds of hormones again until there are eggs or until they decide to go another route. Once they have viable eggs, they'll collect sperm sample from the male through the ejaculate, and then they actually fertilize the eggs in vitro, which means outside of the body in a petri dish or in a lab. These are typically screened and frozen, and so the zygotes are fertilized, but they're frozen. And then the couple can choose amongst how many viable zygotes they got, which ones want to become a blastocyst that are implanted. Some women will choose to implant only a single cell in hopes that it actually takes and develops. Some couples actually choose to implant more than one, hoping that at least one will take. And that's one of the reasons that people who use in vitro fertilization actually end up with multiple births of twins or triplets if they implant more than one blastocyst at a time.